Hospice Savannah has been around for quite some time, and they love educating our viewers on the wonderful services available. And today we're talking about palliative care. Joining me now is Dr. Laura Farless, who is a medical director with the Stewart Center for Palliative Care. Hi, Dr. Farless. It's great to see you.
Thank you.
So let's jump right in and let's educate our viewers on what exactly is palliative care.
Palliative care is care for people who have very serious illnesses such as cancer, heart failure, lung disease, illness that's causing physical symptoms such as pain, nausea, fatigue, appetite issues, anxiety. A palliative care team is going to be an expert in managing those symptoms. A palliative care team is more than that, though. They are also addressing the emotional needs of patients and their families, emotions that come along with having a serious illness, such as sadness, fears, anger even. A palliative care team is also addressing the social needs that come along with serious illness.
So it's not just for one person, as you said, it's for the entire family, really, because everybody's going through whatever the issue is at the same time.
Exactly. We know that serious illness really causes like a ripple effect in someone's life. It's not just the physical symptoms, but effects on the family, effects on children, even spiritual concerns, people questioning their faith, questioning their spirituality, struggling with those particular issues. So palliative care is a team-based approach to care for people who have serious illness and is meant to be an extra layer of support for those patients and their families.
And we all know how important support is when you're going through some type of illness. So now that we've touched on palliative care, how does it differ from hospice care?
So hospice care is care intended for people who have terminal disease whose life expectancy is estimated to be 6 months or less. However, palliative care can be delivered much sooner, much more upstream, if you will, in the care spectrum. So right at the time of diagnosis of a serious illness, palliative care is appropriate. Palliative care can be delivered as a specialty of care right alongside the other care that the patient's receiving. They can still be seeing their doctors, they can still be getting their aggressive treatments. Palliative care is meant to be that extra team support for patients.
So can you give me some examples of the types of people or types of illnesses that can benefit from palliative care consultation?
So there are a variety of illnesses that we see in palliative care. Obviously cancer of any type, any stage. We're seeing congestive heart failure, COPD, lung disease, liver disease, advanced kidney disease, neurodegenerative diseases, really any type of serious illness that affects people in a physical, severe way, as well as their, again, needs for the emotional, psychosocial, spiritual team support.
And of course, you've been doing this a long time. Can you tell me a little bit about a few patients maybe that you've seen palliative care actually work and really help someone's way of life?
Yeah, so the best example I can give is imagine a young woman with breast cancer. She's working, she's raising a family, suddenly she's hit with this very serious illness. She may be having uncontrolled pain, uncontrolled symptoms, really needing to sit down and talk with someone about how she physically feels, perhaps more in depth, taking some more time with her. Because she's feeling so poorly, maybe she's not able to work like she was. So now we're having, some social needs at home, maybe some financial struggles. Perhaps her children are now acting out in school because they don't understand what's going on with mom. Perhaps she's having some relationship issues. So maybe she's asking, why me? What's God's place in this? So really, someone that's suffering in all of those domains, the physical and the non-physical, that's really the best palliative patient is someone that just we can help in all those ways.
And when someone is provided palliative care, this is something that can be ongoing for quite some time. There's not a time limit.
Right. The difference also in palliative care and hospice is that palliative care is treating patients who may have a curative intent, may still be seeking to restore their health to what had been. So there are no limits to who we can see. And we're seeing folks that are very young, some that might go on to get better, and we love to have a graduate of our program, someone that perhaps needs palliative care for some time, but then goes on to no longer need palliative care. So really quite a variety of, we say, any age and any stage of illness.
Dr. Farless, let me ask you this. How would someone go about getting a consultation where palliative care is concerned? How do they find out more information?
First, we're at the Steward Center seeing folks in several of the hospitals, specifically St. Joseph's Hospital, Candler Hospital, Landmark Hospital. We also have an outpatient clinic that we run in coordination and partnership with the St. Joseph's Candler Health System, so we can have folks come into our clinic just as they would go into any other clinic. We're seeing some patients in certain nursing homes in town. We also have some home care services available, so we tell patients if you have an interest and a need to please just call us and we'll find a way to see you.
Well, we want to thank you, Dr. Farless, for coming in and sharing this information on palliative care with our viewers. Hospice Savannah does such a wonderful job. Thanks for joining us today.
Thanks for having me.
If you'd like more information on palliative care or Hospice Savannah or any of our coastal experts, just go to our Coastal Experts page. You'll find that on our website, wsav.com.